Life-altering transgender procedures. Are they vital for mental health or a cash cow for Big Pharma? Welcome to America Uncovered. I'm Chris Chappell. This episode is sponsored by Surfshark. Protect your privacy and secure your identity with a virtual phone number available with all Surfshark plans. I'll tell you more in a bit. So, gender-affirming care. I think that might be a new record for us. Since Trump came into office, he's banned quote-unquote gender-affirming care for minors, banned transgender troops, and kicked out transgender inmates from prisons. This is a big shift from the Biden administration, which was an advocate for transgender rights. Gender-affirming care is a hot topic these days, and transgender advocates want to make sure it's accessible to everyone. They say we need gender-affirming care to affirm people's identities, to treat those who are vulnerable, and to reduce the pain that comes with gender issues. And while this idea has become more and more socially acceptable in the West in recent years, as opposed to the 50s, where if a teen boy told his father he felt like a woman, the dad would say, "I feel like having two women, ha-cha-cha-cha." In the US especially, there's been a big focus on making transgender medical procedures easily accessible to children as well. And you know who believes that the most? Who other than the principled medical establishment? Because they believe in the Founding Fathers. Specifically, truckloads of Benjamin Franklins.
It's a lot of money. These surgeries make a lot of money. So female to male chest reconstruction can bring in $40,000. A patient just on routine hormone treatment, who I'm only seeing a few times a year, can bring in several $1,000s because that requires a lot of visits and labs. It actually makes money for the hospital. And the female to male bottom surgeries, these are huge money makers. They could be up to $100,000.
$100,000. Nonetheless, it's true. There's big money to be made from promoting transgender procedures. As a former Planned Parenthood employee pointed out, trans-identifying kids are cash cows, and they're kept on the hook for the foreseeable future in terms of follow-up appointments, blood work, meetings, etc. I guess cash cows are their true identity. Which is probably why lots of money from powerful organizations is being thrown at research justifying transgender procedures. This Stanford University study is one great example, which argues that early access to gender-affirming hormones reduces the risk of suicide. It was funded by the American Academy of Child and Adolescent Psychiatry, which in turn was supported by pharmaceutical giants Arbor and Pfizer. Both Arbor and Pfizer produce hormonal medications used in gender transition procedures. But don't worry, there's never a conflict of interest when Big Pharma is involved. The sponsors couldn't have played a role. The authors even said so themselves, so it must be true. But you want to hear a fun coincidence? The lead author of that study has even received expert witness payments from the ACLU, which is politically active in promoting gender-affirming care. Since there's so much money being thrown around in support of transgender procedures, it's super duper hard to say no. Plus, it's really for the children. And in an environment where identity politics dominates national discourse, it's very hard to criticize transgender procedures without facing repercussions. If you're a doctor and disagree with this line of care, well, you're just kind of out of a job.
Saying that you're not going to do something because of your conscientious, because of your religious beliefs, is not without consequences, and it should not be without consequences. If you don't want to do this kind of work, don't work at Vanderbilt.
Yeah, because medical schools obsessed with DEI are churning out students that'd be happy to work here, and will probably only kill a couple of patients due to incompetence. Win-win. As a matter of fact, the medical establishment is so set on promoting transgender procedures for children that they'll even try to do it in secret. No, we're not talking about a secret lab, but now that you mention it. Back in 2023, conservative critic Christopher Rufo put out a whistleblower piece exposing how Texas Children's Hospital secretly performed transgender medical procedures on patients as young as 11 years old, despite publicly saying it would no longer provide such services. But I'm glad they did. After all, 11 is definitely old enough to make a decision that changes your body forever. That's why middle schoolers are all covered in tattoos. But remember, there are always repercussions for disagreeing with this type of medicine. So a while after the whistleblower told the truth, the feds showed up at his door, forcing him to come out and identify as surgery resident Eaton Heim. Guess what happened then? They thanked him for sharing his concerns and said they'd have a frank, open discussion about, I'm just kidding, Biden's Department of Justice indicted him with felony charges, citing claims that he had no right to share medical records of minor patients with the public. This is despite the fact that Haim did not disclose patient charts, redacted documents to protect sensitive patient information, and complied with HIPAA, which allows anonymized information to be disclosed. It even allows protected information to be published if it's used to stop egregious medical misconduct. Advocates for transgender procedures on children say that gender-affirming care is a vital service that reduces distress, and to deny that is to attack transgender people. But is that scientific evidence saying it, or is it just motivated by profit and social justice activism? Multiple public health studies conducted in Europe show that evidence supporting transgender procedures on youth is remarkably weak, and that transgender surgeries for minors do not solve mental health issues. Really? I thought dealing with $100,000 in medical debt made everyone feel great. In fact, the European Academy of Pediatrics says the question of whether biomedical treatments for gender dysphoria are effective remains contested. One of the problems that health authorities recognize is that past studies affirming transgender procedures were heavily biased with deeply flawed research. In fact, some relied too much on social justice arguments rather than scientifically based evidence. Even researchers at the Trevor Project, a nonprofit that provides services to LGBTQ youth, couldn't show concrete evidence that hormone therapy for transgender youth causes reduced depression and risk of suicide. And remember, as with the Stanford study mentioned earlier, many of these studies rely on surveys, self-reported data on limited time frames, which isn't particularly scientific. So as a response, many European countries are taking a more cautious approach by limiting youth gender medications, citing how great medical caution must be taken in children and adolescents. And I'm sure America will do the same. I mean, it's not like the U.S. pharmaceutical system has ever, and certainly not over the past several years, overprescribed medication to an irresponsible and dangerous degree. Even Sweden, the first country to introduce legal gender reassignment, is slamming the brakes on treatments for trans minors. These countries are beginning to recognize that transgender procedures don't stand up to medical scrutiny, especially since those diagnosed as transgender often have a whole bunch of issues combined, such as depression and trauma. Even the World Professional Association for Transgender Health, or WPATH, knows that transgender procedures on minors might not be based on the most medically sound assessments. And yet, leaked files released by Environmental Progress show that behind closed doors, WPATH-affiliated healthcare professionals confess that their practices are based on improvisation, that children cannot comprehend them, and that the consent process is not ethical. And yet, some people have vested interest in keeping the transgender industrial complex for minors going anyway. After all, why let cash cows go? Or let gender detransitioners dismantle mainstream narratives? What do they know? I'm sure 11-year-olds would never make a decision they'd later regret. Now, as I said, talking about subjects like this has consequences, which is why I'm so grateful for our sponsor, Surfshark. And they have a great new product that I'm very excited about. Do you hate when companies demand you give them your personal phone number? I do. Every time you sign up for text messages to get a discount at a store, or give out your number when setting up a dating profile, or sell stuff online and need to provide a public contact, you're basically putting your private phone number out in public. And if you wonder why you get so many spam calls and scam calls, that's why. People have your number when they shouldn't. I'd say don't give out your number to anyone you don't know personally, except these days you're forced to. But now there's a way you can set up an alternative phone number, complete with an alternative name and email address, thanks to Alternative Number from Surfshark. You can set them up to redirect to you. But if you start to get too many calls or emails, just shut that profile down and set up a new one. It's easy, simple, and it's brought to you by the same people who protect your privacy online with my favorite VPN, Surfshark. So check out Alternative Number from Surfshark. It's super easy to use, whether on the computer or directly in your Surfshark app. And when you sign up at surfshark.com/altuncovered, you'll get 4 extra months for free. That's surfshark.com/ALT uncovered. Or just click the link below. Protect yourself from spammers and scammers. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.